Welcome from Genetic Alliance to this webinar. Genetic Alliance is a health advocacy organization giving tools to patient advocacy organizations, clinicians, investigators, all to help people drive research. We have some wonderful tools. In fact, one that we've created in partnership with Luna DNA that allows us to enable individuals to share their information and always control who has access to it. For more information, contact me,sterry@geneticalliance.org. We'll be using this system to capture any of the information that you think might be valuable with regard to COVID and the vaccines and your disease community. So contact me if you have some ideas about how this might be useful to you. We're delighted to have Dr. Francis Collins with us today to share with you about the importance of getting vaccinated and other considerations with regard to your disease community. There's far too many people and far too many questions for Dr. Collins to take those today. He has seen all the questions you've sent in advance and will try to answer some of those during this 30-minute period. He has an important federal meeting right after this webinar, and so he can't stay around to answer questions, but we're so delighted to have him for this short period. Feel free to post your location, any condition that you might either have yourself or be treating or be researching in the chat, and anything else you might want to tell Dr. Collins, since we will collect all of the chat and give it to him sometime later today. Thanks very much. And without further ado, thank you, Dr. Collins, for being with us. Over to you.
It's a pleasure again to be linked up again with many of you who I know from many years of working closely with the Genetic Alliance and with a particular concern that I've had for my entire career about trying to help people with rare diseases. And there's a remarkable group of sign-ons happening in the chat box from people with a wide variety of experiences and histories and disorders that are occurring in their family. And I recognize some of you, but many of you I don't know. But I'm really pleased to have a chance to start off with just a little bit of background about what we know and what we don't know about COVID-19, and particularly about the vaccines, which we are counting on to be our path out of what has been a very dark, difficult year. So I'll just maybe speak for 5 or 10 minutes, and then I'll try to launch into the list of questions and see how far we get. And I'm sorry, because of other responsibilities as NIH director, Saturday is kind of like any other day, so I will only have about a half hour, and then I've got to jump into another serious high-level discussion about where we're going with COVID-19 therapeutics. So as the NIH director, I was aware in the very early days of January that something serious was happening in Wuhan, China. And sitting down with Tony Fauci, the director of the Infectious Disease Institute at NIH, who actually works for me, although it's not always clear that it's not the other way around, but a wonderfully, incredibly dedicated and knowledgeable infectious disease expert, probably the most highly respected infectious disease expert in the world, given all that he's done over his last 37 years as the lead of that particular area at NIH. And it was clear that this could be a serious challenge, although I don't think anybody thought by January 10th, when the sequence of the viral genome was posted, that it would end up being as serious as it has turned out to be. Yet we moved quickly to try to prepare just in case. And utilizing this strategy of using messenger RNA as a means to develop a vaccine, which wasn't an overnight idea. This had been getting investigated over some 25 years, gradually building up the case of how this could work. That was then quickly designed in NIH and its Vaccine Research Center, working with the company called Moderna, were able, in absolutely breathtaking timetable, in just 63 days, to have a vaccine that had proven to be beneficial in animal models and was ready for a phase 1 trial in humans. And that happened just in March. Following on the heels of that, phase 2 trials, which of course are a larger number of individuals to see what kind of immune response happens. That looked good. And then by July 27th, phase 3 trials were launched for Moderna's vaccine and for the Pfizer-BioNTech vaccine, also a messenger RNA approach developed at about the same rate of speed. And all of this supported by something called Operation Warp Speed within the US government. I think back on the choice of warp speed and consider maybe that was not the most helpful way to describe this whole effort, because it's created a sense, at least in some people's minds, that this was slapdash. This was just like going forward without paying enough attention to serious issues like safety and the rigor. And I want to tell you, because I have been smack in the middle of this for the last 13 months, that I have never seen a trial design or a conduct more rigorous, more attentive to safety than what we have been doing with these COVID-19 vaccines. The warp speed part of it was basically eliminating a lot of the dead time that usually happens between the first recognition that you might want to make a vaccine and then trying it out in various models. And then there's a dead time where you think about it. And then maybe you do a human trial and then you think about the results for a while. All of that got compressed so that there was no time to waste, because we could see by, as you know, March and April, this had come to the United States. People were dying in New York City, and then pretty soon in the Sun Belt down in the South. We could not afford to take casually any of these timetables. We had to press forward, but never compromising on the safety issues. And so that Moderna trial and the Pfizer trial, both enrolling more than 30,000 participants, some of the biggest vaccine trials that have ever been done. And then double blinded so that people didn't know whether they got the actual vaccine or a saline placebo. And the investigators in the trials didn't know either which one they were administering. This is what double blind means. And then you watch and start to see what happens as far as people getting sick with COVID-19. And you start counting up the number of events. And by November, late November, it was pretty clear there were enough events to be able to unblind the data and look. Now, people are worried at that point because there was a lot of political stuff going on, in case we have forgotten. And there was concern that maybe the conclusion would be manipulated for political purposes. And I want to assure you that did not and would not happen because of the way this is set up. So the only group that got to look at the unblinded data is a data safety and monitoring board made up of experienced scientists with no political appointments included. And they then look at it and they can say, okay, if there were 100 cases of people who got sick who were part of the trial, how many of them got the placebo and how many got the actual vaccine? And for both Pfizer and Moderna, the results were absolutely stunning. That is 95% efficacy. If there were 100 cases of illness, 95 of those happened in the placebo and 5 in the vaccine. And the difference between Moderna and Pfizer was essentially not apparent at all. They're almost exactly the same result. And what about safety? Well, again, FDA, despite some pressure, announced they were not going to consider authorizing any vaccine unless there was at least 2 months worth of safety follow-up for at least half the people in the trial who had gotten both doses of the vaccine. That was pretty stringent. It was not popular in certain places, but they stuck to that. Now, why 2 months? If you look at previous vaccine trials, if there's going to be a side effect, the very high likelihood is it will happen in that first 2 months. It is quite unusual to have things happen after that. So looking at the 2-month data for both of these, it looked extremely good. There were a couple of cases of facial palsy in the Pfizer trial and one in the Moderna trial. But when you look at the instance of that in people who are basically just living their lives in the same way, it did not look like this was out of range. And there was a case in the placebo recipient as well. So FDA did not believe that that was proven as a potential side effect of this vaccine, although there's still some question whether very rarely that might be the case. Other than that, there were no significant side effect concerns. Interestingly, in the trials, with now 30,000 people for Moderna and 44,000 for Pfizer, There were no instances of really severe anaphylaxis reactions, although, as you heard, once the vaccines began to get distributed in the real world, we have learned that that can happen. Fortunately, all of those have been reversible. So FDA looked at all the data in an unprecedented way. They made this totally transparent. They have this meeting of a group called VRBPAC, which is an advisory committee which meets in public, and they go through all the data and everybody can look at every detail. And they concluded in both instances that these vaccines were safe and effective for an emergency use authorization. It's still emergency use because they have not yet got the long-term safety follow-up that you would expect for a full authorization. That generally requires many, many more months. But considering that they had watched carefully for the 2 months where most of the safety issues could happen, and they were satisfied. And considering that this is a disease that has killed hundreds of thousands of people, the benefit versus the risk seemed totally compelling. And so those vaccines, those two, both based on messenger RNA, became authorized in the United States for administration near the end of December, right in time for the holidays, which created a bit of a snarl as far as the initial efforts of distribution. Let's just say those have not entirely been cleared up. We are still at a point now where many people who are anxious to get vaccinated have not been able to do so because we have a supply and demand mismatch. But if you've watched the recent announcements about trying to scale up the manufacturing, which you can only do at a certain pace because it's pretty complicated stuff and you can't just build an extra factory overnight and have them produce a safe vaccine, we will, by the end of July, have 600 million doses combined between Pfizer and Moderna. And that, because it's a 2-dose protocol for both of those, that's enough for 300 million people. Well, we're 330 million in this country, so that would certainly get us to the 90% level where we think herd immunity should be kicking in. But it's going to take time to get there. One of your questions that I saw was about children. And at the moment, Pfizer is approved for children only down to age 16, Moderna not approved for anyone under 18. So teenagers at the moment are in a less certain circumstance. Trials are being run right now for this purpose. Pfizer is running a trial on 2,259 kids between 12 and 15, and Moderna is running a trial on about 3,000 kids between 12 and 17. And this is the usual way it's done, where you start into teenagers, and if everything looks good, then you go down to the next level, maybe down to kids age 6. And all that's done carefully and appropriately, just to be sure that there's no surprises. Fortunately, for the kid trials, we don't have to do another 30,000 children in order to decide. You simply want to do a few thousand and make sure that the antibody response looks like it ought to be protective. And that's good enough to say, okay, we can extrapolate then that a certain level of antibodies is going to protect you against disease, because we saw that in the adults. But that is going to take time. And so frankly, for kids, we probably won't have FDA authorization until sometime in the early summer, based upon these trials needing to get finished. And then they'll gradually work down as far as kids age 6 months and above, but that will take a little longer. The good news is that kids seem to handle this illness quite well. And so the likelihood of really severe disease in those kids is limited. I know all of you are concerned, though, because of kids who have ongoing illnesses, and are they particularly vulnerable? And that might well be the case. So certainly one of the things that we would want to see happen would be those kids who are in families where the kid is not yet a candidate for immunization. The families ought to be, I would say, a high priority to get immunized. It's a little unclear from CDC's recommendations when they talk about healthcare providers being on the front lines. Does that include parents of kids with rare diseases? I kind of think it should, but it's not that clear from what I have seen so far in the various CDC musings about this. So that is a somewhat unresolved question. So the other thing, and then I'll go to the questions quickly, is there is another vaccine which is going to get reviewed in just a few days, the Johnson & Johnson vaccine, which is a single dose. That is going to be nice for logistical purposes. It also doesn't require ridiculously low temperatures for storage, so it's going to be more amenable to administration in low resource settings. It is now under review right now by the FDA, and there will be a public meeting of this advisory committee, the VRBPAC, this coming Friday, where all the data will be out there and the experts will decide whether they think this also should be granted emergency use authorization. In the trial, its efficacy against mild or moderate disease was not 95%. It was lower than that. And it depends on which subgroup you look at, but let's say it's about 70%. But importantly, against severe disease, that is enough to get you in the hospital, it was almost 100% effective. So I guess you have to sort of figure out the balance here. It's a single dose. That's really good. And it protects against severe disease. That's really good. It may not be quite as good at protecting against milder outpatient sort of situations. So that's going to have to be factored into whatever FDA decides. Watch that space. We, of course, need more vaccines. So if it does get approved, and if, as they promise, they can put out 100 million doses for the US by June, well, that's 100 million people because this is a single dose. That could be really helpful. So that's sort of where we are. I think there's all kinds of rumors out there about dangers of these vaccines. Please, everybody, look closely at the real data. It's incredibly accessible. And when you see things in social media that vaccines are causing infertility or that they're actually containing chips from Bill Gates that are going to track what you're doing, just, think about whether that makes sense. There's a lot of things there that frankly, I think people with not necessarily benevolent intentions, but other motivations are trying to put out there to frighten people about these vaccines. And that's really disappointing and distressful when we consider how this can be life-saving. After all, we can look at this circumstance and see just what a terrible toll it has taken on our nation. And this is our best chance to get past it. So let me try to answer a couple of the questions. One is, should you accept a vaccination immediately, no matter which one is offered, or should you wait for one that you like better? I think you should immediately accept your opportunity. That's what I did when I had the chance. My wife, Diane, who's a genetic counselor, finally, after multiple efforts, just this morning, found out that she can actually get an appointment for a vaccine next Friday. And it turns out she's going to get Pfizer, and that's fine with her and fine with me. Again, I think the most important thing is to get this going. And it is kind of a tough supply demand. So if you have the chance, by all means, sign up. Very important question. After you're vaccinated, could you still transmit the virus to other people? We don't know the answer to that. We know that vaccination prevents 95% of your chances of getting ill. But could you still harbor the virus in your nose and throat? And could you therefore, by breathing or coughing, spread it to other vulnerable people? Because we don't know the answer to that, we are still urging everybody, even after vaccination, to continue to wear your mask. That's the best protection against you being an unwitting super spreader, which nobody wants to be. And certainly to protect your family and your friends and your neighbors, and even at the grocery store, at least for a while, we should all still be wearing our masks faithfully, and better yet, double masks, which do an even better job of capturing that virus. There is some early data, but it's still incomplete, suggesting that the vaccines do greatly reduce your chance of carrying that vector, but I'm not convinced yet that we are solid enough about that. So please, everybody, let's just stick with this plan about wearing those masks. Everybody wants to know, how long does the protection last once you've been vaccinated? Is that good for life? Another place we don't really know. Remember, this disease has only been around for a year. So we don't know whether natural immunity from having had the disease means that you can't get it again. And we certainly don't know from the vaccines how long that immune response is durable. We're going to have to track that closely. Will it be like measles, where once you've had that vaccine, yeah, you're immune for life. You don't ever have to have that vaccine again. Or will it be like the flu, where it's changing enough that every year you need a booster of a different variety of a vaccine to try to keep up with the changes? This leads me to mention the fact that this virus, SARS-CoV-2, the name of the virus that causes COVID-19, is a virus that can change over time. It's an RNA virus. And because the world population of this virus is so enormous, because it is spread all over the place, including in the US, there's an opportunity, even for a fairly low rate of mutation, to result in viruses that have changed their coat. You know, this is my pet rock here, this model of the SARS-CoV-2 virus. It's these spike proteins on the surface that you are basically getting immunized against when you are vaccinated. The mRNA version basically codes for those spike proteins, but it codes for a particular version of them, which is the one that first came out of Wuhan a year ago. Over time, some of these viruses have changed their sequence enough that those spike proteins are slightly different in their shape. And so maybe then the antibodies that you got from the original virus won't necessarily still stick as effectively as they should. We're particularly worried about a couple of these that have arrived and have rather rapidly spread in certain parts of the world. There's the British variant called B.1.1.7, which is now in the US and is actually doubling in its frequency in the US about every 10 days. And people are predicting that will be maybe the major virus in the US by the end of March. And it does seem to be a bit more infectious and maybe even a little bit more serious. But the good news is the vaccines work really well against B.1.1.7. Slightly more of concern is a South African variant, B.1.351, which has some changes that make it look as if the vaccine is somewhat less effective in providing immunity, but probably still sufficient. So right now, there's no reason to panic. I think we're on a good track, but I can tell you that all the companies that are making vaccines are already in the process of redesigning to cover that South African variant, just in case it becomes necessary to do so. And of course, that may not be the last one. So we all have to sort of stay nimble here. Again, that's part of why I can't tell you whether getting vaccinated today means you never have to worry about COVID-19. Part of it is, how long does your immunity last? And the other part is, does the virus change so that effectively you need a new kind of booster for that new kind of virus? And both of those are unknowns at the present time. Those are great questions, though. How do we combat the misinformation? I got to tell you, this is really troubling to me as a physician, scientist who believes in the value of evidence and data. And there's so much evidence and data out there. And yet, frankly, we're kind of losing the battle here when it comes to social media, because there's such a rapid way for conspiracies and other kinds of misinformation to spread that tell you you really ought to be worried about this because of a safety concern that is completely fabricated. So I guess I'm going to count on all of you when you hear those things, ask yourself or ask the person who's spreading it, wait a minute, what is the evidence behind what you just said? These are really important issues. This is life and death. There's a difference between an opinion and a fact. Let's look at the facts. And I would argue the facts behind the safety and efficacy of these vaccines, considering the terrible, terrible damage this epidemic is doing to our world, are just overwhelmingly in favor of going forward with vaccination. And if somebody's trying to talk you out of that, demand to see their evidence. And I suspect the harder you push, the more you'll get anecdotes. Remember, anecdotes sometimes can be very compelling. They're human stories. They sound like, oh, wow, that happened to that person. But the plural of anecdotes is still not data. If you really want to know whether something is cause and effect associated, then you need a really rigorous study. That's why we do randomized controlled trials, where you can't be misled by a random coincidence of events. So again, I'm just counting on everybody to try to live up to that kind of standard. Question about side effects. How are they common? What are they attributed to? Well, I would like to say that if after your immunization you have a sore arm and even have a headache or feel a little chilly, that's not a side effect, that's an effect. That says your immune system is at work. It has recognized that it has been presented with a foreign substance, and it is designed to say, oh, no, you don't. And so it is revving up all of those cells that are going to make antibodies and other cells that are part of your cell-mediated immunity, and they're doing their thing. And that's an effect that you should sort of feel proud of. Okay, go to it, immune system. I can tell that you're having the appropriate response. And I want you to do that so that next time, a few months from now, if I actually encounter the real virus, you will already have that program in your file cabinet, and you'll know exactly what to do in the space of 24 hours instead of a week. And that could be the difference between not even knowing you got it and being in the hospital. So that's an effect. That's okay. And that's mostly what people have. The second injection tends to be a little more strong in that regard. When I had my second injection, I was pretty fatigued for about 36 hours. Chilly, sort of felt like not really feeling so good. But then it was gone, and that was that. And I was proud of it. Again, my immune system was doing its thing. There are rare individuals who have what's called anaphylaxis, which is a very serious allergic reaction. And that's why we make people stay for observation for 15 minutes after the shot and for 30 minutes if they've ever had a serious allergic reaction, just to be sure. That's entirely reversible with epinephrine. And there have been enough instances of that to say the frequency for both Pfizer and Moderna is something like 5 out of every 100,000 people will have that. And most of those are people who've had previous severe allergic reactions. So if you have a history of that, or your family does, that would mean something to point out. It's not a contraindication, however, to get the vaccination, simply to just be aware that you might be at a slightly higher risk, and that people should be ready, therefore, to have the appropriate epinephrine ready to reverse it. And everybody who's had that reaction has had it reversed, and they're fine now. But that's the one thing to sort of watch out for. Other things, have we in fact got data to say that these vaccines work for all different ancestries? Well, this was a personal passion of mine, because in the early days of running the Pfizer and Moderna trials, they were kind of doing this in the way that could line people up as quickly as possible. And most of them were people with resources. And frankly, most of them were white people. And if we want to know if these vaccines are safe and effective, we particularly want to know for those communities that have been hardest hit, which in the US is African Americans and Latinos. And so a big effort was made, even involving slowing down recruitment a little bit, to make sure that community outreach was happening. And again, you can go and look at the data. What the result of that is, for the Moderna vaccine, where we worked the hardest on this, 37% of the participants were of diverse backgrounds. So people of color should be able to look at the results of these trials and see themselves, not just the majority population, but themselves. And I hope that's reassuring. Let me just say, I totally understand why people of color, and I'm particularly thinking about the US, and I'm particularly thinking about African Americans, might be a little skeptical about some medical research development that says this will be good for you. They remember Tuskegee, that terrible study that was done a few decades ago on Black men with syphilis who were basically denied access to effective treatment in order just to watch and see what happened. That was absolutely disgraceful, ethically indefensible. Bill Clinton apologized for that more than 20 years ago, but the information and the memory still lingers. And so I can understand why individuals in that community want to be particularly careful to see what the evidence is, that this is good for them and that they're not just being treated as guinea pigs. The evidence is very compelling, and I'm spending a lot of my time trying to be sure that message is out there. But, you know, here I am, an old white guy who works for the government. If they're going to be convinced that this is actually good for their community, that message needs to come from other voices, from their own leaders, from doctors in their community, from churches that I think can also play an important role in spreading the word about what are the true facts and how this could be a way of loving your neighbor. And I'm thinking we're making a little progress there, but it's still a significant uphill battle. You know, folks, I'm going to have to go in a minute, but one of the things that does, in fact, worry me about our future, we're on a pretty good path now. We've got vaccines that we know are safe and effective, 2 of them. Maybe we'll have a 3rd one by the end of this week. We can see our journey perhaps leading us out of the dark woods and into a bright meadow where we are finally able to start to go back to the kind of life that we used to take for granted. But if a third of the people who are offered the vaccine say, nope, not for me. And there are polls suggesting it might be as many as that. Then we don't get there. Then we don't achieve that so-called herd immunity that basically sends the virus packing because it doesn't have anywhere to go anymore. Then this could go on and on and on for months and months and years, and particularly for families who already are dealing with rare diseases that threaten people's health. The last thing you need is to have a prolongation of this infectious disease pandemic. So I think we all have an investment in trying to be sure the truth is out there about the safety of the vaccines, about the importance of us all getting engaged in taking part. Even young people who think of themselves as fairly immune and immortal, they're going to be part of the solution. If they're still capable of getting sick and spreading it, or not even knowing that they have it and spreading it, then this isn't over. So it's partly sort of self-interest to get your vaccine. It's also taking care of your whole community, taking care of the world, to say, yes, I'm going to roll up my sleeve. So I hope this has been useful. My gosh, I only touched on a very small fraction of the questions that you all had put forward. They were terrific. Again, Sharon, thank you for the willingness to make sure that these get captured and that answers as best we can get provided. Many of the questions do have the opportunity for responses from CDC, which is your most detailed source of information. And I hope everybody is looking there first when they're trying to figure out what do we know and what do we not know. But there are also, I'm sure, many specific questions about rare diseases that CDC may not cover. And thank you, Genetic Alliance, for being willing to try to shuttle those into places where people can provide answers. I will do what I can in that regard within the limits of the fact that I'm already working 100 hours a week, but I'm always glad to try to help this community. All you folks, I'm so glad for this Zoom opportunity to link up with you. I would much rather, however, that we were all together in a place where we could have conversations in the hallways, and there could be inspiring stories told by each of you about what kind of experiences you've been going through and how you've dealt with them. And we might even sing a song together, because we used to do that back in the day where we were able to gather together. We are going to get there again. We are going to get through this. Thank you all, and bless you.
Francis, thank you so much for giving us this time that has meant so much to our community to be able to do this. I'll be sending you the chat. Lots of gratitude for your being with us this way, knowing that you have huge things to do for all of us, and enormous gratitude too for the heavy lifting you've had to do through lots of adversity, scientific, political, personal. Really, really tremendous to have you with us.
Thanks, Sharon. Thanks to all of you.
Bye-bye.
Bye-bye.
Thanks, everyone. We are really happy to have had Dr. Collins with us. As I said, we will be bringing to all of you the recording from this session. We'll also look through all the questions we received, which are several hundred actually, and then any questions that came in the chat. And we will be trying to answer as many of those as we can in an FAQ. Those will be posted to Genetic Alliance's website. We will send that out to you all as well, so that you can distribute it to your communities. And we will be continuing to update as we go. One of the things we're thinking about is trying to collect the issues around having had the vaccine and any reaction to it, and do that in a way that doesn't impact your communities, because I know that all of you here are quite responsible about not trying to scare your community, but also want to know what kinds of adverse events might have happened, in addition to what kinds of effects, as Francis said, not side effects, but effects. So we'll be back to you on that kind of a project as well. In addition, we know that you have a lot of questions about immunological diseases, gene therapies, bone marrow transplants, and so on. And again, we will do everything we can to get you answers to general classes of diseases. As you know, there's between 7,000 and 9,000 rare and many thousands of common conditions. So there's no way that we all can know what will happen when a vaccine is administered to someone, whether it's an adult or a child, whether someone's immunocompromised or not. And what we will do is try to get answers to those, and certainly be constantly posting them as science actually ferrets out the answers. In the chat, Tamara Wurst from my office has posted the link to join Genetic Alliance's mailing list so that you can get information readily and easily. And you can find that also on our website, geneticalliance.org. Thank you all for participating. Very glad to see you. Good to see so many good, new and old friends. Happy to have spent this morning, this afternoon, this evening with you. Thank you all.